So guys, good news. It looks like lockdowns are working. Lockdown started on July 6 in Fairfield, and after going up and up for weeks, we saw the first drop in active cases today. We heard a lot about overhanded police presences and the huge testing lines, but it has worked. So why were cases still going up in Fairfield? Well, remember, tests are usually done a few days after symptoms emerge, and when we started testing a lot of people in the area, when we got essential workers to get 3 daily tests, we picked up many cases that were asymptomatic, people who may not have gotten tested otherwise, but who could still have been spreading it. Plus, active cases take a couple of weeks to become inactive. That's why we're only seeing the impacts of the lockdown now. But reduced transmission was likely occurring as soon as we enforced lockdowns, which were complied with. Western Sydney's not our fault. So why are new cases still staying high over the rest of Sydney though? Well, areas that were only recently locked down, or areas that aren't locked down at all, are still seeing cases rise. It's now spreading wider. Spread in lockdown areas likely is going down. Blacktown and Parramatta had cases neighbouring Cumberland districts start from random cases in restaurants to going to Coles and Woolies and then everywhere. These guys only shut down properly yesterday or last week for Blacktown. We weren't doing routine screening of essential workers then too. Right now, in places that aren't locked down, we know that some of them are still going out. That's scary with the Delta strain, which started from a limo driver giving it to someone at a coffee shop. This pattern is being in Sydney and in the east, where malls and Woolies are starting to see infections. Even the Central Coast is at risk right now. So what do? A, we need to lock down all of Sydney just for a few weeks, so we see a regression like it has in Fairfield. We see less random cases emerging and that spreading. And B, we do what Iceland did. The way they got out of their pandemic without lockdowning was because they tested asymptomatic people when outbreaks occurred. Almost half the population has been tested, plus people who were positive, they checked up on them every single day with phone calls to make sure they were staying home. But though Iceland has an advantage in that they only have a population of 300,000 in total, we have an advantage that they didn't have then: rapid antigen testing. Now, you could argue that it's tough for labs to do PCR tests if all of Sydney gets tested, and you could say that these rapid tests have low sensitivity, they may miss cases, but A, we can have a two-tier system. Rapid antigen tests could be used for essential workers or construction workers and students, and then have PCR tests mandatory for doctors, hospital staff, people who've been exposed. B, even though rapid antigen tests may miss more cases, by sheerly testing more people who are asymptomatic, we're going to catch more cases of the virus, when we'll catch them when people are more likely to spread them, when they're asymptomatic. We'll also save a bunch of money too. We've spent over $500 million on PCR tests. A rapid antigen test costs between 13 and 25 times less. That's just lab expenditure, by the way. Rapid antigen tests can also be done at home, so you won't have to spend so much in carrying out swabs. But some other ideas, like why haven't companies like Coles, Woolies and Uber offered free delivery to positive households? I mean, someone out of them will need to shop. They may be causing spread. Help the positive cases stay at home, we'll get out of this sooner. Also, why can't army personnel be trained to be contact tracers? They have thousands of people who could be following up on cases more actively. And why aren't we getting translated announcements to multicultural TV channels and radio stations? Hell, I'll do the Hindi ones. This could reduce confusion. A little bit of innovation could really help. Right now, we're in a critical juncture. If we do this properly, we could be out of this by September. If not, we may be in lockdowns till we get enough people vaccinated, which could be in March. Let's get this right, Sydney. Share this around and subscribe. Next time, I'll outline the facts on the Delta strain, because we've known about this for months. Right now, journalists and politicians, maybe even our health department, either don't know these facts or they aren't doing their jobs.